Great. Thank you very much. It's a pleasure to be with our medical students, and I understand we may have some residents and kind of mentors as well. Many of you probably do not know that about 2 decades ago, I was actually a visiting professor at what was then called the Kirksville College of Osteopathic Medicine. And I used to actually drive to Kirksville from St. Louis a couple times a year to teach a course for the medical students on geriatric psychopharmacology, and then to do some lectures for the faculty mostly on Alzheimer's disease. And I really had a good time there. I didn't enjoy the ride because at that time they didn't have any good highways. They only had a kind of a 2-lane road. But I still remember pulling up on Osteopathy Drive and really enjoyed my engagement with the students and the medical students and all the faculty. So it's nice to be back, albeit virtually, during these unprecedented times. So I was asked to talk to you about kind of risk factors and protective factors relative to Alzheimer's disease or lifestyle kind of issues and Alzheimer's disease. I don't have any disclosures for this presentation. But before I start my formal presentation, I just recently went to my academic office to look at all the different books that I have there. And one of the books I ran into was this book. You may have heard of it, a New York Times bestseller, The End of Alzheimer's, the first program to prevent and reverse cognitive decline by Dale Bredesen. I said, wow, maybe I don't need to give this talk today because the answer is here, The End of Alzheimer's. I continued to look around my office. I found a Spanish translation of The End of Alzheimer's disease. And not only that, but a brief summary of The End of Alzheimer's disease, the first program to prevent and reverse cognitive decline. I said, wow, maybe I'm wasting my time. I continued to look around my office. I found another book, maybe you've seen this, it's called The Alzheimer's Solution. Radically reduces the risk of Alzheimer's disease by 90%. A breakthrough program to prevent and reverse the symptoms of cognitive decline at every age, even good for medical students who are feeling overwhelmed. I said, wow, I must be just really don't need to give a talk on this topic. Another book I found in my office was called The Alzheimer's Antidote, that by using a low-carb, high-fat diet, we can fight memory loss and cognitive decline, just a comprehensive approach, metabolic and lifestyle. Again, I was feeling pretty worthless. I continued to look in my office and I found this Alzheimer's Prevention Food Guide, a quick nutritional reference to foods that nourish and protect the brain from Alzheimer's disease. And then The End of Alzheimer's disease, the brain and beyond. And look at this, The End of Alzheimer's Diet Cookbook with a big piece of salmon on the cover. These are recipes that can help reverse cognitive impairment and Alzheimer's disease. So I really was feeling that I don't need to give a lecture because others have already found the solution to Alzheimer's disease. Here's another solution, The End to Alzheimer's Cookbook. 50 gluten-free recipes proven to be effective in reversing the cognitive decline of the brain. Again, I'm not sure what food that is, but looks like maybe a piece of seafood of some sorts. And then here's a really good one, a step-by-step guide to using diet and high-energy foods to protect and nourish the brain. It's called the coconut oil, which is great to use if you want to have an early heart attack and early cardiovascular disease. The coconut oil and low-carb solution, not just for Alzheimer's, but also for Parkinson's, as well as a variety of other brain diseases. So I really felt that maybe I don't need to give this talk. But then I looked at one of my journals that just had come out, and there was this headline, which was something very real and very tangible. And this talked about 2 large studies, epidemiologic studies, that occurred in the Chicago area, the Chicago Health and Aging Project and the Rush Memory and Aging Project. And it had to do with the impact of healthy lifestyle on the risk of Alzheimer's disease. And what they did was these two studies had over 2,300 patients, older adults, that were followed over time. And they assigned what they called a low risk or healthy lifestyle score to each of these individuals at the beginning, and then they followed them over time to see what happened. So here were the 5 low risk, healthy lifestyle factors. And these are important to keep in mind. Never a smoker, because we know smoking is a huge risk factor for Alzheimer's disease. Individuals who exercised, walked or exercised a minimum of 150 minutes per week. It's about 20 plus minutes a day. Number 3, light to moderate alcohol intake. 1 drink a day, 1 ounce of alcohol a day for women, up to 2 drinks a day for men. High adherence to the Mediterranean diet or the MIND diet, which is a combination of the Mediterranean diet and a diet to prevent or treat hypertension. And then lastly, engagement in cognitive activities, keeping the brain active. So what did they find? So in the first study, 293 of these individuals developed Alzheimer's disease after a 9-year follow-up. In the second epidemiologic study, 6-year follow-up, 229 patients developed Alzheimer's disease. But here's what they found, and this is very real, very tangible. This is advice that we can give our families and our patients who are worried about Alzheimer's disease. Those that had 2 or 3 low-risk lifestyle score, in other words, 2 or 3 of the 5 they adhered to very, very carefully, had a 39% lower risk of Alzheimer's disease. But look at the next bullet. Those that adhered to 4 or 5, pretty much all of the risk, basically lifestyle healthy score, 60%, 59%, nearly 60% lower risk of Alzheimer's disease. So the study concluded that adherence to all low-risk lifestyle factors can provide maximum benefits and may be an effective strategy for lowering risk of Alzheimer's disease. So this really made a lot of sense and makes a lot of sense to me. The following day, I was reading The Onion. Many of you know the satirical magazine, The Onion, which is available online. And they saw this headline from the study, and they right away picked up on it. And they said, study finds healthy lifestyle can cut the risk of developing Alzheimer's disease by 60%. Then they got reader responses like they usually do. And this is very interesting. What are the readers saying? What's the public saying when we tell them this? One of them says, I'm getting sick of researchers expecting me to do things when they should be the one coming up with cures. Second person said, people must really hate Alzheimer's if they're willing to live a long, healthy life to avoid it. And then lastly, this is a comment again in The Onion. So you're saying there's nothing I can do. And what that tells you is you can lead a horse to water, but you can't force him to drink. We're going to review a number of factors, modifiable risk factors, that may be helpful in either decreasing the risk or delaying Alzheimer's disease, but a lot of people may not necessarily adhere to those recommendations. A couple of questions to consider when we go over the presentation. One is lifestyle modification an active treatment to prevent or delay Alzheimer's disease, which may be comparable or maybe even better than any medications that we might be able to come up with? And then secondly, is strict adherence to a healthy lifestyle realistic? Well, who knows, based on what we hear in The Onion. And if it is, can it overcome even genetic loading, even genetic risk factors? So let's move on to our presentation. I don't have any disclosures, as I mentioned earlier. Somehow it's not allowing me to make this larger. Just bear with me for a moment. Just hold on. I think somehow I pulled up the partial presentation, and I'm going to get you the full presentation in just a moment. That's not the right one. I know that I sent you guys the slides. Are you able to pull them up or not?
Debbie, do you have copies of the slides? I don't.
Just give me 1 second. I'll have to pull them up from my. So one of the fun things about technology is when things go right.
Yeah, and then he said he's not going to give us a lecture.
Well, these people that are joining late, they're not going to miss anything except for the first part. Give me 1 second. I'll pull this up. That's the wrong one. You get to see all my talks here. Hopefully we're not losing too many people.
You could try going up on your screen to the slideshow tab.
Okay, I've got it now. All right, sorry about that delay, but we'll try to make up the time. All right, so let's talk about risk factors and protective factors related to Alzheimer's disease. Can you see the slides okay?
I think it's still your old slides, maybe?
You don't have the white and blue?
No.
Okay, let me see if I can share the screen. Share. How about now?
No, it's still the green ones, Dr. Grossberg.
Wonder why.
Can you try stop sharing and then sharing again?
That's what I'm going to try to do. Yeah, it's not allowing me to stop share. Let's do new share. All right, I think this will work. How about?
Yes.
How about now?
Yes.
All right, sorry about that. Okay, so let's move on to the bulk of the presentation. We're gonna talk about promising research relative to delaying or preventing Alzheimer's disease and things that may be risk factors or protective factors. We'll talk about hypertension. We'll talk about exercise. We'll talk about reproductive history. We'll talk about education. We'll talk about smoking. We'll talk a bit about periodontal disease. We'll talk about dietary approaches. We're going to talk about a really exciting new area of young plasma infusion. We'll talk about another promising area of photobiomodulation. And then lastly, a new brain disease that looks like Alzheimer's disease, but it's not, which is called late. And we're going to do all of that in the next 42 minutes. So we got plenty of time. We're in good shape. All right. So first to talk about blood pressure. This initially came up at the Alzheimer's meetings 2 years ago and has since been published last year in the literature in JAMA. And this is a very important study called the Sprint Mind study, which looked at the impact of tight control of systolic blood pressure and the risk of later developing cardiovascular events, as well as things like mild cognitive impairment and overt dementia like Alzheimer's disease. Funded by the NIH, 4-year study, over 9,000 subjects at risk for cardiovascular disease, looking at aggressive control, which is defined as a blood pressure, a systolic of 120 or less, versus 140, and its impact on cardiovascular, cerebrovascular events, including mortality, and risk of mild cognitive impairment, which is a prodrome to dementia, and all-cause dementia. 120 sites in the US and Puerto Rico. Here's the results of the study. Aggressive blood pressure control reduced cardiovascular events and mortality, and decreased the risk of mild cognitive impairment by nearly 20%. The risk of dementia was 17 to 18% less, and there were less changes on neuroimaging. But the bottom line was, what's good for the heart is good for the brain. Now, as you can see, the 19% reduction in the rates of mild cognitive impairment was statistically significant. But the 17 and 18%, the 17% decrease in dementia risk was not statistically significant, primarily because this study had to be halted early because of the tremendous increased risk with higher blood pressure for cardiovascular events. So there weren't enough subjects to really look at what happens with dementia. So right after this data was announced, the Alzheimer's Association themselves announced that they are funding a 2-year extension of this study to see if indeed tighter, better control of systolic blood pressure may also result in a statistically significant decrease in the risk of all-cause dementia. And that data will be coming out next year. Now, here's another important study. When we see patients in the office with their families who are worried about things like dementias, like Alzheimer's disease, and they know that it's important to exercise, to keep fit and to do some kind of exercise. Often they want to know, well, what evidence do we have that doing regular exercise, and how much exercise, and what type of exercise do we recommend? That if we do those things, how do we know that we maybe in fact can decrease our risk of developing Alzheimer's disease? So this particular study was called the MyHat study, looked at over 1,200 patients with normal cognition. These are older adults with normal cognition, followed for progression to mild cognitive impairment. And keep in mind, as I mentioned earlier, mild cognitive impairment is the prodrome to Alzheimer's disease. And what they looked at were individuals who had 150 or more minutes of exercise a week versus those who didn't exercise very much, who had a lot less than that, in combination with cardiovascular risk factors. And these were the risk factors: hypertension, hyperlipidemia, BMI, obesity, diabetes, smoking, cerebrovascular accidents or TIAs, coronary artery disease, excessive alcohol, arrhythmias, and congestive heart failure. So of this cohort of over 1,200 patients, 373 developed mild cognitive impairment over 10 years of follow-up. Adjusting for age and sex and education and so on, what they found was that there was a statistically significant reduction in the risk for mild cognitive impairment in those that did at least 150 minutes a week of exercise or more versus those who did not exercise. And this was a very robust finding that we can tell our patients and our families about, that it's really, really important that you exercise. Walking is recommended exercise for most, because most people can walk unless they're paraplegic, God forbid, that they can't walk, then they can do aerobic things. But again, the amount you want is 20 or more minutes a day, at 140 to 150 minutes a week. However, what's really interesting is there are two very, very strong risk factors. One is inheriting the ApoE4 genotype, and the other is smoking. So those that had ApoE4, as well as those who continued to smoke, they were not able to overcome that risk with exercise alone. So again, it just shows you we don't know how to change our genes, but we really need to strongly advise people against smoking. Now, this is the study I mentioned to you earlier. We're not going to review that again, but let's talk a bit about some data that came out of Kaiser Permanente in California. This is an interesting study, looked at reproductive history and dementia risk. Over 15,000 women between the ages of 40 and 55. Here's what they found. Again, there's limitations to this kind of study, but it makes us think about estrogen, about other sex hormones, and how they may relate to dementia risk. Here's what they found. Number of miscarriages, 9% increased dementia risk per miscarriage. Age at first menstrual period, usually it's around age 13. Those that had a significant delay, let's say age 16 or beyond, 31% increased dementia risk. Age at menopause, natural menopause, usually it's around 47. If it came early, less than 45, resulted in a 28% increased dementia risk. Reproductive period, which is about 30 plus years, if it was less, only 21 to 30 years, resulted in a 33% increased dementia risk. Now, this was based on self-reports, but it makes us think that maybe longer exposure or greater exposure to estrogen and maybe other sex hormones could decrease dementia risk. There's more work to be done in this area. Now, all of you have probably been taught, I know I was taught when I was in my training, that it's a good idea to build up cognitive reserves as you get older, to do this when you're younger and in your middle years. And one of the ways of doing that is by getting more education, by keeping the brain active, by reading, by doing all kinds of things we can in our earlier years so that we have more cognitive reserve. And education has been the proxy for cognitive reserve. This study, which came out last year, looked at the same patients or the same subjects in the Rush Memory and Aging Project, as well as over 1,200 subjects from the Rush Religious Order study of older clergy. And you could see the demographic here. Average age, mean age was 78. Most of them had nearly a high school education. They were followed for about 8 years or more. And interestingly, they agreed to cognitive testing and brain autopsy at death. Not all of them ended up having the brain autopsy, but many did. So of those that had the cognitive testing every year and also had brain autopsy, neuropath exam, there were about 405. And here's what they found. across all participants, education was associated with initial level of cognition, which makes sense, but not with a slower rate of decline. And of those who developed dementia, education was not linked to rate of onset or to a slower rate of cognitive decline. So this study really challenges our notion that education may be a good proxy for cognitive reserves. It may not be. Now, what about senior moments? We've all talked about a lot of our older patients, maybe they're in their 70s or 80s or 90s, and they're going to a social event, and they're having a conversation with someone else, and they're talking about another individual, and they're trying to think of that person's name. They can't think of that person's name, and they say, oh my goodness, I'm having one of those senior moments. Or they can't think of a certain fact from the past, and they'll usually cover it up, and they'll say, oh, there it goes, I'm having one of these senior moments. Well, senior moments are what we call subjective cognitive decline or subjective cognitive impairment, which is a prelude for many people to mild cognitive impairment, which is then a prelude to dementias like Alzheimer's disease. But the key difference is people with these senior moments or subjective cognitive decline, when you do cognitive testing on them, they are perfectly normal for their age and their background and their educational level, and they're fully functional. But we now know that people who have a lot of these senior moments may in fact be at higher risk for future cognitive impairment. So this particular study looked at risk factors, vascular risk factors, neuropsychiatric risk factors, to see if people don't just have senior moments, but have these additional risk factors, if they may be at increased risk of amnestic mild cognitive impairment, as well as Alzheimer's disease. The study was done at the University of Minnesota. They looked at over 1,500 patients with senior moments, mean age of 74, about 2/3 were women. They were followed for nearly 5 years. The risk factors that they looked at were hypertension, diabetes, hyperlipidemia, obesity, and smoking at baseline. Again, remember, these are individuals with a mean age of 74. The psychiatric risk factors were anxiety and depression at baseline. So what did they find? What they found after nearly 5 years of follow-up is that quite a few of these patients, 322, developed mild cognitive impairment. About 64 developed overt Alzheimer's disease. And the two most significant risk factors that stood out were smoking, double the risk, and depression, about 1.3 times the risk. Again, the importance of counseling against smoking, counseling against chewing tobacco, counseling against vaping, counseling against using other smokable substances, which may be risk factors, and then recognizing and treating depression, which may also be a risk factor. Very interestingly, in this cohort, many of whom were already moving into their 80s, being overweight was actually protective. And this has been called the obesity paradox. Now, they were not morbidly obese, so they weren't 300 or 400 pounds, because they're not going to live to be in their 70s or their 80s. But these were individuals that had some extra weight on board. And we now know that people in later life, in their 70s and in their 80s, who maybe are thin, who are cachectic, maybe malnourished, maybe immune compromised, don't do well. Whereas individuals who are not cachectic, not too thin, but have maybe a few extra pounds on board, actually can do better relative to their immune system, relative to their risk of developing conditions like Alzheimer's disease. Now, as I mentioned at the beginning, we're going to talk about gum disease. This has been in the news quite a bit. So here's a very interesting study that came out last year looking at Porphyromonas gingivalis. That's a mouthful, or PG. PG, or Porphyromonas gingivalis, is a key pathogen in chronic periodontitis or periodontal disease, gum disease. Interestingly, pathologists have found the same bacteria in close proximity to the plaques and tangles in the brains of Alzheimer's patients. So this bacteria actually can go into the bloodstream, cross the blood-brain barrier, and it gets into the brain in patients who also have Alzheimer's changes. We also know that these bacteria, this PG bacteria, secretes a toxic protease. And this toxic protease is called gingipan. And these gingipans, we know from animal studies, animal models of Alzheimer's disease, increase the production of A beta, of the plaque, as well as the tangles in animal models. And we know that they themselves, these gingipans, are toxic to neurons. Again, as I mentioned, a small molecule crosses the blood-brain barrier. But the good news is that we do have drugs that also can inhibit the gingipans that are secreted by Porphyromonas gingivalis. In addition, these compounds that can inhibit the gingipans block in animal models the production of A beta, decrease the production of the amyloid plaque. They also decrease neuroinflammation and may have a protective effect relative to neurons in the hippocampus, which is kind of the seat of Alzheimer's disease. And these gingipan inhibitors are already in clinical trials for treatment of Alzheimer's disease. So stay tuned to the data on gingipans, which are secreted by one of the primary bacteria that causes gum disease, particularly in later life. Now, what about dietary factors? The MIND diet does seem to be a very robust diet, and it's the one that we recommend for all of our older patients who are worried about Alzheimer's disease, as well as their family members who are worried about getting Alzheimer's disease later. It's a combination of the Mediterranean diet and the DASH diet for hypertension, of a low sodium diet as well. It's called the Mediterranean DASH diet intervention for neurodegenerative delay. Now, individuals that highly adhere to a MIND diet, and in this particular study, looking at offspring from the Framingham Heart Study, almost 1,500 dementia-free subjects, mean age of 69, were followed for over 8 years. What they found was that those that really, really, truly adhered on a day-to-day basis to the MIND diet has statistically significant lower risk of all-cause dementia, including Alzheimer's disease. Now, here's another very exciting new avenue of potential, kind of an emerging potential treatment for Alzheimer's disease. I think some of you, maybe who've done laboratory work, know about the concept of parabiosis. We can't do this with humans, but we can and do this with animals, animal models of Alzheimer's disease, where we can hook up the circulatory system of one animal to another. So for example, you can take two rats or two mice, one very young, robust mouse, one aging, kind of a senescent, kind of maybe a demented mouse, and hook up their circulatory systems. And by transfusing through the plasma neural growth factors in these animals, there's a positive effect on the older animal. So the older animal starts to become younger, like the young animal, and you see more neurogenesis and synaptic plasticity in the brain of the older animal, mostly in the hippocampus and the subventricular zones. So because of this, a small biotech company called Alkahest in California came up with a concept that if we can in fact take plasma with a variety of kind of protective factors, growth factors, may even have some stem cells and so on, neurogenetic factors in the plasma from 18-year-old young, healthy, non-immune compromised individuals infuse that plasma with all those factors into the circulation of advanced Alzheimer's patients who are generally quite elderly, that this might have a therapeutic effect on even advanced Alzheimer's disease. We are actually working and hoping to work with this company to actually show this, but what they have been able to show is the safety of plasma factor infusion into the circulatory system of older adults with Alzheimer's disease. And this is the study that's being planned. It's a pilot study, 20 elderly subjects with severe Alzheimer's disease. 2/3 will get the infusion, 1/3 will get placebo infusion. It's going to take place in the special care unit of a long-term care facility as soon as our long-term care facilities open up because of COVID, which is a big issue with long-term care, as you all know. They'll be getting daily infusions during the first week, and then they'll be followed for a period of 10 weeks, a variety of safety measures and a variety of efficacy measures. And this may potentially bring hope to a patient population for whom there's no hope. There's no treatment at all. And that would be individuals in the most advanced stages of Alzheimer's disease. So let me share with you some data from a poster that was presented at the Alzheimer's Association International Conference about 2 years ago. And it was a poster that looked at 8 adults with Alzheimer's disease, mean age of 78, and they were exposed to what's called transcranial and intranasal photobiomodulation. The poster was a PhD researcher from the University of California at San Francisco, and what she did was 20 minutes every other day of low energy near infrared LED light was transmitted transcranially and intranasally for 12 weeks versus a control group that had no exposure to see what benefits exposure to this photobiomodulatory therapy could have clinically on Alzheimer's patients. And what they found was very interesting. Again, only 8 patients, that it showed that there was statistically significant improvement on the ADAS-Cog, the cognitive measure, as well as behaviors from baseline to the end of 12 weeks with the treatment. What they also found was that this photobiomodulatory approach increased blood flow, and it increased the connectivity of the brain's default network. The default network is what's really keeping us going while we're kind of sleeping at night and are not fully conscious. Based on this very small study, the Canadian government and their NIH variant, they, together with a couple of sites in the United States, are now initiating a study, a multi-center, randomized, double-blind, placebo-controlled study to look at 228 patients with moderate to severe Alzheimer's disease who will be exposed to photobiomodulation for 20 minutes, 6 days a week, for 24 weeks versus sham photobiomodulation. It's co-sponsored by this company called V-Light and the Canadian Center for Aging and Brain Health Innovation. Interestingly, if you go on online on Amazon or just Google photobiomodulation or V-Light, you can actually buy this for $1,800 and you can do your own thing. This is what the equipment actually looks like. So on the left is what goes on the skull, and then this is what goes up the nose to provide the photobiomodulatory therapy. But before any one of you recommends to your parents or grandparents that they go out and spend $1,800, I would really wait until the multi-center trial, sponsored mostly by the Canadian government, the data comes in, and we should be having data on that study in the next 6 to 12 months. Now, as I mentioned to you before, something that's also very, very new And, it's amazing that, here we are, in the year 2020, and we're still finding things out about the brain and about brain diseases that we just didn't know anything about until now. So where was this disease called limbic predominant age-related TDP-43 encephalopathy? How come we didn't know about it? Well, the reason we didn't know about it is that we were looking at it, but we just didn't know what to look at or what to look for. So what this is a dementia subtype. It's a new subtype of dementia which can look like Alzheimer's disease, but in most of these patients, they do not have the Alzheimer's neuropathology. What they do have is deposits of a protein called TDP-43. It's not A beta, not the plaque protein that you see in Alzheimer's disease. It's called TDP-43 in the brain. It seems to mostly affect older cohorts. So about a quarter of the individuals are over the age of 85 who have the late neuropathological changes, and almost all these individuals are in their 80s or 90s. They present with an amnestic dementia syndrome. Some of them can also have the amyloid beta and the tau. They may also have evidence of Alzheimer's type changes. Interestingly, this phosphorylated form of this protein called TDP-43 has also been found in frontotemporal dementia and in amyotrophic lateral sclerosis, also known as Lou Gehrig's disease. Where was it before? Well, pathologists previously who saw someone who clinically had significant dementia that looked like Alzheimer's disease, but then they didn't find any of the Alzheimer's changes in the brain, would diagnose that patient as having dementia without Alzheimer's disease neuropathology. Or they would talk about hippocampal sclerosis, because a lot of this deposition of the protein is in fact in the hippocampus. But we now know that this is in fact a dementia subtype which can mimic Alzheimer's disease. It seems to progress more gradually than Alzheimer's disease does. As I mentioned earlier, it affects mostly older people, well beyond their 80s. And then we know that those that have both the late neuropathology as well as the AD, the Alzheimer's disease neuropathology, that they seem to be the ones that have the most agitation, the most difficulties with out of control agitation and aggressive behaviors. This recently described entity and diagnosed entity, unfortunately, has no current treatments available as of yet. But of course, we're working on treatments as we speak. So let's kind of finish up with some conclusions, and then we'll have about 5 to 10 minutes for questions. I think, as you all know, Alzheimer's disease is a very complicated brain disease. This late entity that mimics Alzheimer's disease is a new dementia subtype. Keep that in mind. We do have, as you all know, current FDA-approved treatments which are symptomatic and may have an effect on disease progression and may improve quality of life for patients and caregivers. There's also growing evidence, as I think we've begun to show, that lifestyle modification, including treatment, good treatment, tight treatment of things like hypertension, a variety of cardiovascular risk factors, adopting a rigorous exercise regimen, adopting the MIND diet, that all these things together, avoiding smoking, excessive amounts of alcohol in moderation, may in fact have a dramatic effect in delaying the onset as well as decreasing the risk of Alzheimer's disease. Some of you know that right now at the Food and Drug, at the FDA, pending approval, which may happen as early as this coming new year, maybe winter to spring, we are actually close to potential FDA approval of the first drug for treating agitation as well as psychosis in Alzheimer's disease. And in addition, there is now in front of the FDA around the same timeline, maybe sometime next year, the potential approval of the first disease-modifying therapy for Alzheimer's disease, which may actually be able to slow down significantly the rate of progression. Because of a lot of failures in the amyloid-targeted therapies, there's a move away from amyloid to looking at other targets, other reasons or other potential contributors to cell death, other reasons why cells may die in Alzheimer's disease, such as inflammatory changes, neuroinflammation. There's an increased focus on the microbiome, looking at gut bacteria, looking at bacteria coming from the oral cavity, other parts of the body, looking at the impact of oxidative stress and free radical toxicity to see how they may contribute to why cells die in neurodegenerative diseases like Alzheimer's disease. And I think the field is increasingly viewing lifestyle modification as an active treatment, as a tool that you and I can give our at-risk elderly patients and their families as a way to potentially delay or modify the risk of developing devastating diseases like Alzheimer's disease. That's my last slide. Thank you all very much. Thank you for listening and hanging in there during my technical snafu. And I think we do have about 5 or more minutes for questions or comments.
Dr. Grossberg, I just wanted to ask a question, well, a couple of questions. Regarding the reproductive history and the dementia risk, I've always thought that estrogen actually increased, long-term use of estrogen actually increased the risk for cardiovascular disease, which seems like almost a contradiction when you were talking about the reproductive history. So, I mean, I don't know if I misunderstood that. So just wanted to
no, you didn't misunderstand anything. That's a really great question and an important point. So the Women's Health Initiative study, we learned a lot from that, taught us that it's not a good idea post-menopause, okay, to supplement women with estrogen, either estrogen or the combination of estrogen, progesterone, particularly longer-term supplementation because of the increased risk of cardiovascular events and the increased risk of gynecologic malignancies. Okay. So what we're talking about in the reproductive health study is not so much extending or supplementing. We're talking about natural menopause, where you have the hormone there as part of the process, versus shortened menopause. So individuals who have the benefit of natural menopause versus those that have a much more limited natural exposure to not just estrogen, but a number of reproductive hormones that may be cut short because of an artificially short menopause. And that's different than supplementation post-menopause. Those individuals have not been studied for increased risk, and they were not part of the Women's Health Initiative study.
Okay.
But thank you for asking that.
Yeah. And then my second question is, so, really so much is coming out about exercise, diet, staying cognitively engaged. Where do you think we need to start focusing versus like focusing on those that are like in their latter 60s, early 70s? Do we really need to shift that focus to even to younger adults, and what age range would that be?
Yeah, absolutely. I think you're making an excellent point. So first of all, we're looking at two populations of younger and middle-aged adults. We're looking at one population that has never had a family history of dementia or particularly Alzheimer's disease. And then we're looking at a family where often there is a strong family history. maybe a parent, maybe a grandparent, maybe siblings and others. So obviously, if I was in a family where there is genetic loading, where there's a family history, I would be much more enthusiastic and much more interested in adopting these healthy lifestyle factors as early as possible. But even in the families where there has not been strong genetic loading, I think the earlier the better. So we're shifting that lifestyle back further and further. Now, of course, we know it's very hard to get high school students, college students, young adults to be kind of paying as much attention to something that may have a payoff 50 or 60 years down the road. But the earlier the better. And there's no downside to starting earlier with these beneficial protective factors. So as an example, if we talk about smoking or vaping being a significant risk factor, obviously it's a good idea to not smoke earlier in life as well as throughout life. But we also believe that even if you, let's say, were smoking earlier, it's never too late to quit. Right. So you can quit and maybe still have some benefit, not just for your lungs and vis-a-vis lung cancer, but also for the brain. The same thing with alcohol. Maybe one was not a moderate drinker, but can switch to being a very moderate or modest drinker and avoid further damage. Or if you come to the Mediterranean diet later in life, it can still play a prominent role. So it's never too late, but I think the earlier the better, and I appreciate your comment about that.
Thank you.
I think you asked all the good questions.
Well, it's great, very informative. I really appreciate it.
My pleasure. All right, so not hearing any more questions, I think I'm going to say goodbye to everyone. I look forward to meeting you in person, and let's hope that we're all able in the future, sometime in the near future, to be able to travel so that I can meet all of you personally. But everyone stay well, be safe, and start thinking about these risk factors and protective factors, not just for your grandparents and parents, but also for ourselves. Bye-bye.
Thank you, Dr. Grossberg.
Take care.